Meanwhile, Health Minister Zweli Mkhize says South Africa faces a high risk of resurging coronavirus infections that may lead to a review by the council deciding on lockdowns. This after new cases rose by 42% in the Western Cape province in the last 2 weeks. Mkhize said the increase in infections and deaths will inform the recommendations that the Health Department makes to the National Coronavirus Council. He added that according to their resurgence plan, they define the significant spike in new cases in the Western Cape as a resurgence. Now, to discuss this and what exactly is happening around the country, why people are not adhering to COVID-19 protocols, Professor Carin Runciman is Associate Professor, Centre for Social Change at the University of Johannesburg. A very good evening to you, and thank you so much for speaking to us. We'll get to your study in just a moment, but just looking at the national infections, those have risen by almost 11% in the last 2 weeks. Why are we seeing this concerning trend? Is it because of what I've just mentioned, pandemic fatigue?
Well, thanks for having me this evening. I think there is very much definitely a phenomenon of pandemic fatigue. The findings from our latest survey show that 4 in 10 South Africans are sort of no longer worried about coronavirus and really believe that the worst has passed. But unfortunately, as this rise in cases demonstrates, we cannot afford to be complacent. That if we relax the preventative measures that we should be taking, such as social distancing, wearing masks, that we are going to see the kind of rise in cases that we are currently seeing.
I mean, I was just listening to a statement in Parliament earlier on of one of the MPs speaking about just the extent of fatigue in this country, saying that there's corruption fatigue and a fatigue over a whole lot of other things. Is this compounding why people want it to be over rather than actually believing that it is over? I mean, your survey says 4 in 10 adults believe that the threat of the coronavirus is an exaggeration.
Yes, absolutely. So what we see is that combined with only 1 in 3 adults not wearing masks when they go outside. And I think that very much corresponds to the general experience that most of us are seeing in day to day, where people are perhaps wearing masks when they go into a shop because they're required to, but everywhere else that's not really happening. And I think what's also important here is this issue of institutional trust. There is a strong relationship between people's trust in the president and trust in national government and their adherence to the public health measures. So those who are less trusting of the president or national government handling of the pandemic are less likely to be compliant with things like wearing masks. And this is where issues like corruption, as you pointed out, are very, very important in terms of actually their public health impact. It makes people less trusting, less likely to do things like wear a mask, which are essential measures to keep us safe during the ongoing pandemic.
And I want to understand the rationale of those that you surveyed. 65% say they do have trust in the president. What about those who don't? Are they looking at it from the perspective that South Africa was able to pretty much get a stranglehold of infections early enough that even though we are the highest in Africa and became at some point top 5 in the world, that the level of infections and death rate does not compare with countries in the Northern Hemisphere? Why don't they trust him? Is it because of his handling or other periphery issues that are related to COVID-19 handling?
Well, in our survey, we provided a space in which people could send a message to the president. And many of those messages talked about corruption. It was a very dominant theme. So while I think everything else you've said has been important, that obviously in South Africa, we haven't seen the high mortality rates that have happened elsewhere, although we must remember we have had considerable numbers of cases as well. But comes to this factor of institutional trust is actually very, very important. So the state's response on corruption around PPE tenders, etc., is incredibly important to the public health response, not just about corruption on its own.
And I want to talk about the issue of fear that your study also draws on, the fact that there were frequent feelings of fear at the very onset of a lockdown. But if we go towards September, for instance, that declined considering parallel changes in perception of risk measures. So talk us through this, and I want to do that against the backdrop of what we saw in the Western Cape, that super spreader event at a bar in the Southern Cape as well.
So as you've said, what we saw in the earlier stages of the pandemic across April, May, June, July, we saw very high levels of fear, and this has declined, and this obviously corresponds to the lower alert levels, the way in which for many people their lives have turned back to some kind of normality. Obviously not completely normal, but much more normal, and making people much more relaxed. And as we see the phenomena of the super spreader, people beginning to relax their adherence to social distancing. Our findings also show climbing numbers of people who have been at religious events or other kinds of events where there have been more than 50 people. And of course, the more that happens, the more likely we are to have an increased caseload, as transmission is much more likely in those kinds of situations.
Professor Runciman, just a final question. You had a fairly balanced, as you say, demographic sample. We heard the Minister and the Presidency earlier on warning people in rural areas to ensure that they wear their masks. And I'm just curious what insight you got from, I think, was it 2 million people that you spoke to? Did you find that geographically it was people in a particular area who chose not to wear masks, who didn't believe that there was indeed corona and there was fear of it? Or was it just random individuals whose behavioral change has been consistent? Behavior has been consistent throughout.
So we've yet to get to that particular level of analysis from our survey results. But what I can say, based on the experience of our survey team, of course, one of the curiosities of this period is that we've been spread across the country, so we're able to bring in our insights, is in rural areas, from what I am hearing, there is less compliance. And that even stems back to the beginning of the lockdown in April, where we weren't seeing the same kinds of measures being implemented. And that also corresponds to people's perceptions of risk, where there was a sense in many rural areas that this was really something that was going to affect urban areas. So I think, that geographical element is incredibly important, but it is still something that we need to investigate further.
Thank you so much for speaking to us, and we look forward to that. Professor Carin Runciman is an Associate Professor, Centre for Social Change at the University of Johannesburg.